Hello, everyone, and welcome back to another episode of Health Beyond Borders, brought to you specially by Malaysia Healthcare Travel Council. I'm your host, Malini, and today we are diving into a topic that sits right at the intersection of life saving medicine and human transformation. We often talk about wellness as something you find in a spa, but today we are talking about a different kind of reset. One that strikes proactively against chronic killer diseases such as type 2 diabetes and heart diseases. As Malaysia positions itself as top choice for medical tourism in 2026, we are looking at bariatric surgery not just as a procedure but as a new life intervention delivered with world class hospitality. Therefore, to guide us through this journey, we are joined by a true pioneer, Dr. Reynu Rajan, and she is a leading expert in upper gastrointestinal and bariatric surgery at Pantai Hospital, Kuala Lumpur. So, Dr. Renu, before we start talking about the science behind the scale, could you kindly introduce yourself and tell us a little bit about your role at Pantai Hospital, Kuala Lumpur?
Okay, so hi Miles, thank you for having me today. It's truly an honor to be a part of MHTC's wonderful program and podcast. So as you know, my name is Reynu and I'm an upper gastrointestinal surgeon. It's quite a mouthful, but in the industry we're rather known as upper GI surgeons, it's short and sweet. So what we do is we actually handle a variety of diseases and surgeries related to the gastrointestinal tract, such as reflux, esophageal and stomach cancers, as well as obesity surgery.
Right. That's actually very interesting, Doctor. All right. If you are okay, I would like to dive right into the questions
Sure,
of our
let's
first
go in.
segment, the ice-breaking session. All right. So, if you could prescribe one Malaysian experience, like a specific food, a place, or even just a feeling, to every international patient, what would it be?
Interesting question, Miles. I think, you know what? I think your last answer would be the answer that I'd pick, which is I would prescribe a feeling. The
Right.
feeling of being cared for like family. You see, in Malaysia, healing doesn't just stop at the operating table. From nurses who remember your name to the warmth of our people, the smile on their faces, patients don't feel like medical tourists. They feel welcome. Many times I've heard my patients say that they feel almost a familiar sense when they come to Malaysia. It's like they've been here before, even though it's their first time. And that emotional safety actually plays a huge role in recovery.
Right. So, you also personally feel that this is actually a very important element.
Yes, I do.
All right. So when we say our tagline, healing meets hospitality, what is the first thing that comes to your mind and about how your team at Pantai Hospital KL welcomes a new guest?
So to me, it means that patients never feel just like a case number.
Right.
From the first consultation, my team focuses on reassurance, clarity, and kindness. Above all, I think empathy as well. We explain, we listen, and we anticipate fears. Now, when I say fears, it doesn't just mean about the surgery, but the financial aspect as well. You know, a lot of people actually worry about that. Is it going to burst their bank account when they think about international travel and healthcare? But these are things that we actually go into when we see a patient and we discuss in length and create an environment that is actually comfortable for them to be open about issues like this. Clinical excellence is expected, but hospitality and empathy is what makes this journey memorable and expedites healing to the trajectory that we want it to be at.
All right. I think that's an incredible way to look at it. Okay. So you were the first Malaysian surgeon to perform a single incision bariatric surgery. Excuse me. Does that make you the superhero of the operating theatre, or are you just someone who really hates scars?
Oh, okay. So I wouldn't call myself a superhero, but I guess I'm just a surgeon who listens to patients.
Right.
So very early on in my career, I remember my patients asking me, Doctor, how many scars are there going to be? Is it going to be a huge incision? Is it going to be 6, 7, 8 scars, right? So I realized that this was something of concern to patients. And I think many patients are not just worried about their health, but their confidence and body image as well.
Right.
Before we want someone else to appreciate the way we look, I think we need to be happy with what we see in the mirror. So single incision bariatric surgery was about that. It wasn't just about reducing physical but also emotional scars. And if it helps someone feel whole again and if it helps someone love what they see in the mirror, why not? I think it's worth it.
That's amazing, doctor. Like, I mean, who would have thought, right? Such an intense procedure could be done with a single incision.
Yes, it's technically difficult, yes, but not impossible. And it's something that I love doing because the joy on patients' face when they lift up their shirt and say, "Oh, just one hole." It's a completely different satisfaction altogether.
Feels like a compliment on its own, right? Like,
Yes.
wow. All right. Okay, doctor. So, 10 years from now, do you think medical tourists will fly to Malaysia, for more of our world-class surgeons or for our world-class recovery environment?
Surgeons or recovery environment now? Again, fantastic question, Miles. I don't know how long it took you to come up with this list, but amazing. You're really working me. Okay, so I think it'll be both, but the recovery environment is what sets Malaysia apart.
Right.
Many countries have good surgeons, but what Malaysia offers is healing with a touch of humanity. Skilled doctors, modern hospitals, cultural warmth, amazing smile on everyone's faces, good food adapted for recovery, and an environment that supports both physical and emotional well-being.
All right. Okay. So it is clear that the environment here is a huge part of the cure.
Yes.
But for many listening, bariatric surgery is still a bit of a mystery.
Yeah.
So let's peel back the layers on what actually happens once a patient decides to reclaim their health. What are the very first, first steps towards this journey?
So I think first of all, we need to destigmatize bariatric surgery, and not just bariatric surgery, but treatment related to obesity.
Right.
People don't want to talk about obesity. If someone wants to talk about obesity, you're seen as lazy. You're seen as taking the quick fix way out. And then if you decide on surgery, that's another taboo surrounding it. So I'd like to emphasize that bariatric surgery is not just as simple as making the stomach smaller. It is a powerful hormonal reset whereby hunger hormones reduce, insulin sensitivity improves, and patients, yes, they feel full sooner. But it's a whole gamut of things that's just like you said, we need to peel beneath the many layers of how this wonderful surgery doesn't just make someone look smaller, but sort of settles a lot of medical issues that they're suffering from. Nobody walks around with a neon headlight saying that I've got this disease, right?
Right.
Nobody wants to talk about it, but they're suffering in silence. And bariatric surgery is something that we see can create dramatic improvement, like you said so well just now, in diabetes control, blood pressure, metabolic health, and you know what? Even infertility. We've got
Right.
a lot of patients who are struggling silently with infertility issues. And it's not just women, Miles, it's also men.
Right.
So often within days, weeks to months, we see these things going into remission. And that's why I truly believe that bariatric surgery is not just life-changing, but life-saving.
Right. That's very interesting. I mean, as a person, I used to be almost 100 kilos,
Wow.
like 6 years ago.
Wow.
But I had no idea such a surgery existed.
Yeah.
So, and I also did not seek for any medical help or
Good on
advice.
you. I mean, it's amazing that you were able to do that without surgery. But at the same time, kudos to you and kudos to someone who chooses surgery. There is no one magic fix that fixes everything for,
Exactly.
Every individual is targeted and treated as they are. And I think it's time we actually start this conversation about weight loss in a healthy manner, like how you're doing it right now.
True. I mean, I
So
would have
thank you for the
considered-
opportunity. Thank
You're
you.
welcome, doctor. I mean, thank you for sharing this because I would have definitely, if I had a choice, I would have definitely opted for that surgery instead of going through the 6 years of all the training and all the intermittent fasting. I remember how many times I had bad gastric problems.
yeah.
I mean, if this surgery could be done to tackle such a major issue, then why not?
Yeah.
I think people's approach to this surgery should actually change.
Yes,
And
to
I hope that it will.
destigmatize. That's the
Yes.
word. Removing the stigma, surrounding obesity and treatments related to obesity.
Correct. I think as of now, it's looked at as more of an
Cosmetic,
aesthetic,
yeah.
cosmetic option.
Sadly, yes.
Yes.
Sadly, yes.
So thank you so much, Dr. Reynu. That kind of concludes our first segment. We will take a short break and we will continue our next segment very shortly.
you.
Thank you. Hi everyone, welcome back. So we ended the note very strongly on destigmatization. So doctor, what does success look like to you in this bariatric surgery?
So, Miles, I like to maybe dissect it into two: success to me and success to the patient. right?
Amazing.
So, on a superficial level, people will say, oh, success means, surgery is done in an hour and a half, patient's okay, and that's successful. But success to me is I always go back to the first day that I see a patient.
Right.
Anytime a patient comes in my clinic, I always ask them, tell me why you're here. Oh, I want to lose weight. No, tell me why you're here. You've
Right.
always wanted to lose weight. What brought you to my clinic today? You could have come a year ago, you could have come 5 years ago. Why today? Why are you here?
Right.
And then I will remind them at the end of their journey, whether 6 months or 1 year, the reason that I remember in my head why they walked into my clinic. And if that reason has been achieved, that is success to me.
Wow.
That is success to me. Now, for a patient, of course, it could mean a lot of things from their diabetes going into remission, no longer on hypertension medication, the day they bring that baby that they've been yearning for, 7 years trying to conceive, 11 years trying to conceive, failed IVF 2 to 4 times, all the emotional ups and downs, and finally being able to hold your own baby in your hands. The day they walk into my clinic and put that child in my hands, it's I cannot begin to start to tell you what success means, because success is not a number when it comes to bariatric surgery, Miles.
Oh my God, this is amazing, doctor. I mean, like, to be able to see how much you have made someone's life better, and
Thank
like, that how far they have come along from this. All right. So I've actually read that this surgery can actually reverse type 2 diabetes and hypertension almost immediately. Is it true that some patients walk out of the hospital no longer needing their medicines?
It's very true. Actually, Miles, interesting story to share with you. I had a patient that was referred to me by an interventional pain specialist. This patient was about 68 years old, very bad knees, already on a wheelchair. And I remember her telling me that she just wants to feel like she's able to go walking with her grandchildren if they ask her to go to the mall and stuff like that. Because 9 out of 10 times when the grandkids ask her to follow for any family outing, she tends to shy away and say, no, grandma's not coming.
Right.
And the reason is because of her knees. So she came into my clinic because of that. But in the background, she's also got diabetes. She's on insulin, 3 different type of medication for that purpose, 2 other medication for her hypertension. So she came with a whole gamut of medical diseases
Right.
besides just the knee problem. And when we did this bariatric surgery for her, of course, the first thing was that she was able to walk without the help of a wheelchair, And I remember she dressed up in nice matching clothes, matching scarf, she had a clip here.
There's
I
already
remember.
an increase in confidence there.
Yes, I know. And my nurses were saying, Doctor, Mrs. So and so is here in our clinic, and she's really dressed up. She wore matching clothes, and I thought that was the cutest thing. But more than that was when she walked into my clinic and she teared and she told me that, Doctor, I never knew that my diabetes would go away. I no longer am using insulin. How is this even possible? Did you do something to my hormones? That's what she asked me. So, this is something that a lot of people don't understand and don't see, the hormonal and cellular effect of how bariatric surgery works. And it's not just mechanical, or it's not just the number on the weighing scale.
Right. Okay. So beyond weight loss, what happens to chronic conditions like sleep apnea or like hypertension? How quickly do patients see a reversal signs or like symptoms after surgery?
I think within the first year, you'll see a lot of this reverse. Interestingly, for sleep apnea, within the first month.
Oh, wow.
Yes, my patients who were using CPAP machines before this, or their spouse saying that, I had to sleep outside because the snoring just wakes up the entire neighborhood. I've got patients telling me that my husband or my wife now hugs me and sleeps, and they need to check on me whether I'm alive because I'm no longer snoring.
Oh my God.
It's that quiet. It's that quiet. If previously they had to tap the person so that they breathe, now they're like tapping to see if they're still alive. Because
Okay.
and that's something sometimes shocks the spouse as well. Like, how? You have this.
How did you do it?
Yeah, I know. And then sometimes it feels like what we do is magic. So
Okay.
yeah.
All right. Okay, so this is for the patients who are going for the surgery, lah. So for a patient who's going under the knife, I'm sure they are like nervous, especially if they're from a foreign country. How has the safety of these procedures changed over the last decade? Is it as safe as common surgeries like gallbladder removal?
So when it comes to safety profile, yes, you're very right. And it's interesting that you pick gallbladder removal, because a lot of people do have their gallbladders and appendix removed when it's a necessity, right? So it is as safe as gallbladder surgery, which is known as cholecystectomy. And when it comes to surgical approach, from open surgery to keyhole, and from 5 little keyhole scars to 3 and even 1 now, lesser scars, lesser pain, faster recovery. You've got better anesthetic drugs. We choose our patients carefully. We've got enhanced recovery programs, which then transform safety and has brought about wonderful changes over the last decade. So, yes, surgery is not only feasible, but it is so much more safer today than what it was 50, 60, 70 years ago.
Oh my God. I'm sure this answers a lot of people who are actually very keen on getting to know or like actually having some idea about this bariatric surgery.
Miles, our patients actually get up and walk within 6 hours of surgery. They take a shower the same night of surgery. So that's actually part of our safety protocol. They're supposed to take a shower within 6 hours, assisted, of course, because some of the anesthetic drugs are still in
Right.
place. And they're made to walk along the corridors of the ward the next day to ensure that their circulation is kept good. You
Right.
know?
I think that's an amazing evidence. Evidence and proof to what you are doing. I mean,
We even avoid putting in urinary catheters or unnecessary
Okay.
lines so that, not to restrict the patient's movement. So, like I said, this surgery has become much safer today than what it was 70, 60, 70, 80 years ago.
that's incredible, doctor. Thank you so much for sharing that. Okay, let's get to the age part. Is there like a perfect age for this, or can someone in their 60s or even a very young person opt for this and start their journey at PHKL?
So there is no perfect age, Miles. It's about medical fitness, not numbers.
Okay.
But having said that, my youngest patient is 17 years old.
Okay.
Well, 16 going on 17, and my oldest patient was 71 years old.
Right.
So it's about why, like I said, why is that patient in our clinic today? And we try to meet those requirements and those expectation, and we select our patients carefully so that we can make whatever dreams they have for themselves come true. Of course, for the younger patients, they're usually brought in by the parents because of some knee problem or some maybe sometimes even learning difficulty due to sleep apnea. Imagine having a 16, 17-year-old who can't concentrate in class because of the sleep apnea, right? They fall asleep when the teacher is teaching. So with weight loss, through whatever methods that we have, whether surgical or non-surgical, we're able to help these kids. So yeah, at an older age, of course, we're looking at quality of life. I always ask the patient, it's not about aging. Everyone ages, but how would you like to age? I think that's very important. How would you like to age, right?
Right. I think that goes well with that term. You age fine like wine. Yeah, that's
Gracefully,
the goal.
that's the word. And with
Gracefully.
dignity, I think dignity is something we don't talk about. You
True.
want to have as much dignity going into your old age for as long as you can before you become dependent on someone. So mobility, quality of life, these are things that we don't talk about. Right?
True.
We always talk about blood test results,
Oh
We don't
yes,
talk about quality
blood.
of life. Yeah.
Blood test results and I mean the very usual test that is always taken and done by the hospitals, and like I think it's also important for parents to know if their children are actually lazy or they do have some medical conditions.
Genuine
Yes.
things, yes. That's actually preventing them from being their best.
Correct. Thank you so much, Dr.
You're most
Reynu. I think we had a very informative segment. So we'll take a very short break and we'll continue again on the next segment.
Sure.
All right. Thank you. Welcome back, everyone. We are now hitting on the most spiciest part of the segment. Okay, so now let's talk about what is the secret ingredient to a high success rate. Is it the surgeon's hand, the technology, or the patient's commitment to the post-op lifestyle?
You see, just because we're talking about bariatric surgery and weight loss, she brings up things like ingredient. After this, she's going to ask me where we're going to go and eat, right? So it's all about food when
I'm
it comes to
already
weight loss.
feeling hungry.
Yeah, so there are three parts to this, Mal. It's the surgeon, the system, and the patient themselves.
Right.
Yeah, technology and skill matter, but long-term success depends on education. I don't mean the patient's education background, but the role of the surgeon in educating the patient.
Oh, that's a very
giving
good
them
point.
all aspects of what they are getting themselves into. Because you don't want the patient to think like how everybody else thinks, right? Which is, oh, if I do surgery, I magically become smaller and my body just gets toned and contoured like as if you just had liposuction as well.
Okay.
Bariatric surgery is not body contouring. It is a powerful hormonal reset and it is a weight loss surgery, right? So it's not going to make your excess skin suddenly magically get tighter. That's going to require you to wear compression garments, exercise, and come for regular follow-up.
Okay.
This is where the patient's realistic expectations and goal setting has to be met.
Right.
Okay, I can't emphasize enough on patient commitment as well, and that's why in PHKL we have a very structured program from start to end, how we take this patient along that journey and how we not only transform their body and their health but also their mindset.
Okay, so it's a whole game changer, lah.
It's a boot camp.
Right. Okay, for someone, if someone is watching us from, say, London or Dubai right now, how do they start? Like, walk us through the very first virtual consultation to the moment they land in KL.
So the virtual consultation does not need to be once. It can be
Okay.
many times as it takes for the patient to feel comfortable to actually make that journey. So the patient sends the medical records. We assess everything, the sustainability, explain options, and plan. We link them up with the international patients liaisons office, surgery, accommodation, recovery timeline. Everything is discussed so that by the time they land in KL, there are no surprises. You don't
Okay.
want an oops moment, you know. Yeah.
All right, for our global audience who are watching this, you better take note, yeah, because this is actually a very interesting option that's provided to people who are actually battling with weight issues.
Yeah. And we don't want patients to think that, oh, they've got this one virtual consult and that's it.
Okay.
Because after the virtual consult, you might have more questions, like questions that you probably forgot to ask during that first session. So I always tell my team that, look, if the patient needs to speak again, let's rearrange the schedule for another virtual consult. We do not want patients who are either half ready or not quite ready yet to make that long journey all the way to Malaysia, only to feel like they did not get the information that they should have gotten. Like I said, we don't want surprises. We want happy faces when they come for surgery and happy faces when they leave.
Oh, doctor, that's actually a very good thing done from you and your team, as part to reduce the hesitation from
Yes.
patients to actually
Yes.
approaching you with more
Correct,
questions.
because I always put myself in their shoes. You see, my parents are not doctors.
Right.
I mean, somebody's going to put a knife on you. You definitely want to have all the information. There is just no room for any doubts.
Right.
Yeah.
Like I said earlier, since I was pressing on secret ingredient, I'm gonna touch on food
Okay.
now. Okay, so being Malaysian, we all love our food here.
Yes, we do.
Okay, it's a food paradise lah. How do you help international patients navigate our delicious nasi lemak culture while they are on their new post-op health journey?
So, Miles, I think the key ingredient here is that we don't fight food culture, we work with it.
Amazing. Okay.
There are healthier ingredients that can substitute our high calorie, dense taste, amazing food that we have. So our dietitians help patients enjoy Malaysian flavors safely but mindfully. So recovery doesn't mean deprivation, but it means learning how to balance. So that's something that I try to inculcate in my patients from day one. You see, I tell my patients I have Americano or a black coffee without sugar because I love to eat. So it's not about
Right.
restricting everything. It's about finding that balance that you can keep going for years and years and years. Not doing some crazy diet program or some crazy compromise that you can only hold on to for maybe 2 weeks or 2 months. And then after that, you go on a rebound journey. No longer weight loss journey, but a rebound weight regain journey. We don't want that. We want something that patients can take home, a new knowledge that they can take home and find sort of a middle ground, not just while they're in Malaysia, but also while they're back home.
All right. Thank you so much, doctor.
You're most welcome.
All right. Moving on to the warmth of Malaysia. So, how does the warm, multicultural environment of Malaysia actually helps the patient heal faster compared to a cold clinical setting elsewhere? I'm not giving any examples, but just based on these two scenarios.
So I think you pretty much gave the answers already. Warm weather, diverse food, calm environment, the smiles on, I think, not just the hospital staff, from the support staff to the nurses and the doctors, but even every regular Malaysian on the street.
Right.
We are known for our smile.
That's true.
We smile at police officers.
Very true.
Right? So there's a very famous song, Senyum seindah surya
Oh my
yang
God.
membawa makna. Senyumlah dari hati, duniamu berseri. So I'm sorry, I'm not a good
Wow,
singer, but
doctor,
I tried. But yeah. I think every Malaysian from my generation, maybe a generation older, also will know that song. And I think it just sets the tone right. We are loving, smiling people, and it's impossible for anyone from another country to come to Malaysia and say, oh, Malaysians don't smile. I've never heard that. So I think these things matter. Like I said, when patients come here, I've always heard that, you know what, I feel like I've come to Malaysia before. I feel like I've seen this person before, this place before. There's a sense of familiarity.
Right.
And I would definitely attribute it to the smiles of our people.
Okay.
I think it makes a huge difference.
Thank you so much. Like we say, a smile goes a long way.
It does. It really
It
does.
really does. All right. Doctor, this is a bit human interest. Lah. Can you share a story of a patient who was considered a high risk case but achieved a total health turnaround? Like what made that success possible?
So I don't know where to start and end because we operate on high risk cases from a day-to-day basis.
Okay.
From 200 kgs to 350 kgs, you name it, we've done it all. But like I said, we select our patients because end of the day, it matters to not only the patient but also to the surgeon that the patient really wants this.
Right.
I often tell family members that if you're dragging someone to my clinic and forcing them to have this surgery, please don't choose surgery because it has to come from that individual themselves. Then it's worth taking all the risk in the world.
Right.
But of course, safety mechanism. So when we see a patient for the first time, we counsel, we lay it all bare, and then we explain to them what are the steps that we're going to take to reduce the risk. We often forget that there are steps to reduce the risk or risk reduction strategies.
Right.
So it's quite a detailed conversation. That'll probably be for the next podcast. But yeah, podcast 2.0 on bariatric surgery.
Oh, wow. Looking forward to it
but
already.
like I said, amazing things. I've had patients who are 300 kgs who've never left their house in 7 to 8 years.
Wow, that's...
whose hobby now is buying sneakers. Not the candy bar, but actually the shoes and
Right.
walking. And I've got siblings say, you know what, doctor, all he does is, he asks us to take him out here and take him out there. But 8 years of being trapped in the house, let him walk. If he wants to walk, let him walk, right? One of my 300 kg patients just recently got married 2 years ago, right? From being trapped in a house to being married. There is no end to the amazing transformational journeys I have seen. But the most important thing is reclaiming their lives.
Right.
There is no amount of money or number or anything. Like no textbook in the world tells us that matters.
Yeah.
Everything is just statistics. Everything is just, this sugar control is this, the BP is this. But reclaiming their lives, coming to my clinic in tears and saying, thank you.
Okay.
When the amazing things from promotions at work to having their lives just change for the better 180 degrees, right? There's just no words that can describe how happy a person that makes me. Forget about being a surgeon, but how happy a person that makes me. I love my job.
Oh my God. That must be really overwhelming sometimes also.
For my nurses also.
Yeah.
I remember my PHK nurses going like, I didn't know bariatric surgery can do all these things.
Right.
Why are your patients always hugging you? They're not used to seeing a doctor-patient relationship transform from being patient to almost a friend.
Right.
But that is the rapport. I always tell patients that you're stuck with me for life. You have surgery with me, you're stuck with me for life.
If I'm the patient, I wouldn't mind, doctor.
I take that as a compliment. Thank you.
Okay. But I mean, it's more than just being trapped at home.
Yes.
I think it's a part of being trapped inside themselves.
Yes.
You are trapped in a body where you can't do anything about it. Some people feel like they have no much options left.
Yeah.
So I think you are actually giving a lot of answers to those people who are struggling to find answers. So from the bottom of my heart, because I used to be from that category, you see.
Yeah.
Thank you so much for what you do for the
Most
people.
welcome, Miles.
Yes.
Miles, on that note, right, talking about being trapped in themselves, right? My 300 kg patient, I remember the extended family members. You see, he came with his parents.
Okay.
But the extended family members who didn't even live within the same vicinity of this patient actually called up the parents the minute they knew that he was going to have bariatric surgery and said, why are you going to cut his stomach? This surgery, people can die. But remember, this patient was 300 over kilos.
Oh my God.
And when the mom expressed this to me, I said, so what are your thoughts? And I asked the patient as well, what are your thoughts? And the patient said, you know what, doctor, it doesn't matter what anyone thinks. I'm dying every single day. Every single day that I'm alive at this weight is a bonus. And I want to make sure that I've done everything I can to fight for this life that I have. This is not living. I'm just existing. I want to truly live. So I gave him a high five and I said, you know what, remember this because I'm going to hold you to this.
Right.
Remember this. I'm going to go all out for you. Just promise me you'll go all out for yourself.
That's very, very kind of you. Seriously, I mean, I also think that it's very important that patients find doctors who are able to encourage them and motivate them throughout the journey, I mean, at first, everybody starts strong.
Yes.
In between, the doubts come in and all those hesitations come in. So, yes, I think
It's not a sprint. It's a ultra marathon. It's a long haul journey that we go on once the patient decides to have bariatric surgery with us.
Thank you so much, doctor, for sharing that with us. Okay, I'm going to touch a little bit on staying connected with your patients. Yeah, once they fly back home, are they on their own, or does Pantai Hospital Kuala Lumpur stay digitally connected to them to ensure their long-term recovery and success?
Oh yeah, they can't escape. They're stuck with us for life, remember? So they not only have my mobile number, but we also do regular digital follow-ups. My dietitians as well are on board. My nurses would call and check on them. I've got my own support staff that would reach out to them. And we have that digital communication that's ongoing, like I said, for life. So recovery doesn't just end at discharge. That's something I tell patients. I always tell patients that success of surgery is 50% the surgery and 50% that lifelong commitment.
Right.
And that lifelong commitment is, I'm not going to throw it just at the patient alone. It's all of us. It's a teamwork, including the spouse or the family members.
Absolutely.
Because many a times weight gain, there are enablers who contribute towards it. So it's
Yes.
very important that the family members also understand what this surgery is about and how they can help this patient and not sort of subconsciously sabotage it. You know what I mean? Like,
Yes.
he's eating only liquid, let's have some cake. Like, no, we need the family members on board as well so that the patient's journey is as seamless as it can be.
Correct. I mean, like if they could help the journey be smoother
Yes.
for their loved
Yes.
ones.
So I always say that it's going to be tough not only on the patient but their loved ones as well, because it's
Right.
not easy to see someone who loves food actually cut down. At some
Yeah.
point, as the loved one, right, we're going to be like, "You sure
they're
you don't want to eat?
struggling. You see them
sure? Oh my
struggling."
God, why? Why are you only eating this much? Do you want some extra rice? Like, can I just top up for you?"
I mean,
So
it's no harm, but you are going to disrupt the
yes,
recovery
yes,
process.
correct. So we deal with not just the patient but the entire environment, including the family members as well.
Right.
Yeah.
That's amazing what you and your team at PHKL does.
Thank you.
I mean, okay, let me talk about the hospitality upgrade a little. So, what is the one hospitality touch of your team? I mean, anything, like it could be something that you guys have recently added, or maybe a specific way you communicate or comfort in the ward. Um, anything that you have seen really that changed the patient's mood?
Yeah. Okay, so the first thing that my nurses would tell you is that Dr. Reynu's consult is never 5 minutes. Waiting time can be quite long, but once you're in her clinic, in her room, you'll understand why she takes that long.
Why? Okay.
I think it's to set patients at ease, right? Like I said, you're going to put a knife on someone's body, right? It's a big, and it's not like as if it's an emergency surgery. It's a lifestyle surgery, even though it's for your chronic diseases, but it's not something that's an emergency. You're not in pain.
Right. Right.
So patients need to feel at ease that, okay, I am making the right choice for me. And I always tell patients that when you get on this journey, you're also going to be needing to be a bit thick skinned. You're going to need to turn a deaf ear about what other people say,
Right.
because this is your life and this is your best shot at living your best life. So all sorts of discussion goes on in my room. And my nurses are constantly reminded never to judge a patient. I remember very early on in my career, my nurses would ask the patient, "Oh, you only, for example, 78 kgs. Why are you having this surgery?" And I had to sit down, and this is over the course of 10, 15, 20 years, right? Sit down and talk to my staff and my team and say that, look, the patient is 145 centimeters. She's got avascular necrosis of a hip,
Okay.
which means she has very severe hip problems, right? At 78, that already puts her in an obese category. Every single orthopedic doctor is telling her to lose weight. Oh, but why didn't the patient tell me this? She's in pain. She's not going to give you a whole lay down of her medical summary. But the last thing she needs is to be judged. I do not want any of my patients judged. So when it comes to my entire setup, every single person who is in contact with my patient, from me to my clinic nurses to my ward nurses, and even the staff in the operating room who is receiving the patient, is well aware about where my principles lie and how I approach bariatric surgery and what it means to me and the patient when they choose us at PHKL to be a part of their life transforming journey.
I think I was a bit touched by that part. I wish I had that help when I was going through that journey, but yes, it's all said and done. Okay, I mean, like, I hope this episode helps those who are actually looking for a solution for their weight problems.
Yes.
It's not because since it's not only addressing weight, it's also going to address a lot of issues that's going to come in due to this increase of weight.
Yes.
I think PCOS is also
Yes, fertility, like we discussed earlier, right?
right.
And the whole baby, not just for women, but also men. Male infertility is also linked with obesity. And a lot of male patients with infertility issues are also referred to my clinic. And I just love working with this subset of patients. Like I said, the day they bring that baby and put that baby in my arms, it's a whole different feeling. Whole
Feeling you
different feeling.
cannot describe,
Yes.
doctor. Oh my God.
Yes.
God bless you always.
Thank you.
All right. Okay. So let's talk about the 2026 legacy for Malaysia Year of Medical Tourism. So by the end of the year of medical tourism for Malaysia, what is the one thing that you want the global community to say when they think about the healthcare in Malaysia?
I think I'd like to look at Malaysian healthcare as that we're not just treating diseases, but we restore lives. And we do it
Right.
with a smile. We do it with a smile. We not only help patients get healthier and happier, but we leave them with hope. That
There's a
to
human touch. Right.
Yes, hope that tomorrow is going to be a better day. And the years that come, you're just going to live your life to the best of your potential and not just exist.
Right.
And you always have us. You're stuck with us. And you're always welcome to come back and eat our food.
The one thing you don't regret is having the food here.
Yeah, no, it's a blessing. It's an absolute blessing.
All right. I think we have actually come to the end of our segment, Dr. Renu. Thank you so much for showing us that, surgery isn't just about procedures, and it's about the person and the new life that they get to lead. So, therefore, to our listeners, if you're ready to reclaim your health, Malaysia is waiting with open arms, and you can reach out to Dr. Renu and her team at Pantai Hospital Kuala Lumpur to get more information and to get a proper consultation from our expert herself. Okay, so you can find all the links later. We will be sharing it with you in this video. And until next time, we request everyone to stay healthy, stay informed, and stay inspired. Thank you so much,
Thank
Dr.
you,
Renu,
Mars.
for
Thank you,
today.
MHTC. Thank you to everybody who's watching this wonderful podcast.